This is the rare Tuesday KCHLC quarterly meeting. Normally we're on Thursdays, sometimes Wednesday, rarely on Tuesdays. But World Cup is coming in case you haven't heard, and so everyone's schedule is a little bit off. So thanks for coming. I'm excited because I think Tuesday gives an opportunity for a lot of people who can't do Wednesday or Thursday to come. So welcome to some new guests that can't always join us. Um, we've got a great presentation today. I've seen it before, and I think it blew my socks off. So I think the same will be true for you. But before we start in with that, we're going to do just a 5-minute networking activity where we would like you to find someone that you don't know or don't know all that well or haven't seen in a while and spend 2 to 3 minutes just talking. And we've got some prompts that you can use, or you can just catch up if you just want to catch up. And in about 3 minutes, I'll have you switch and try to find someone else. And like I said, you can talk about whatever you want to talk about, but some things you can talk about are what is one thing that you're hoping to take away from today's session? AI is rapidly upon us, and I think we're all learning how to use it in our lives. So maybe you can integrate that into your question, or what's a fun fact about your role, team, or company that others may not know? All right, let's go ahead and begin.
Sorry, I'm late.
Okay, I hope everybody had a chance to connect. I forgot to mention that we have a delicious breakfast over here back in this corner. Please feel free to grab it now or throughout the presentation. And of course, there's coffee over here. I also neglected to introduce myself. My name is Robin Shook. I'm the director of the KCHLC at Children's Mercy. And I'm extremely excited to present our speaker, our keynote speaker for today. As I mentioned, I saw a version of this talk a few months ago, and I immediately grabbed the speaker and said, I want you to come and talk to our KCHLC quarterly meeting. So our speaker today is Dr. Ayu Olageko, excuse me, and I'm sure I'm butchering that. And her presentation is going to be on leveraging AI, artificial intelligence, for better health communication and a healthier lifestyle. And she's got an extremely impressive resume. So I'm going to read the long version of it so you understand what I mean. She is an assistant professor in population health at KU Medical Center based in Wichita. So she's going to give a virtual presentation today. And the director of the Health Communication Solutions Lab, where she leads the development of technology-driven, AI-enabled tools to advance what she terms precision health communication at both clinical and population level. Her work focuses on designing human-centered web applications, multimedia resources, and AI-powered prototypes that support clearer, more equitable communication across patients, providers, and communities. Her training is very impressive. She has formal training in public health and advanced training in AI product design and rapid prototyping through the Stanford School of Engineering. She bridges population insight with innovation. And this is what really, you'll see this come out. She also incorporates storytelling as a core approach to communication design, supported by formal training in script writing from the New York Film Academy. Her research examines how AI can responsibly enhance health communication, reduce misinformation, and strengthen public understanding and engagement. She brings both a systems level and design-oriented perspective to conversations about AI in clinical and population health. So we've got quick transition to get her presentation up here, but please welcome Dr. Olagoke.
Thank you, Dr. Shu, for having me. Such a great privilege to be here. I'm going to go ahead and share my screen. Can someone please confirm if you can see my screen?
Yes, we can.
Yes, we can.
Okay, thank you. Yeah, so once again, I'm excited to be here. And one of the reasons is because anytime I speak with domain experts, subject matter experts who are doing great, amazing work, they usually have this light bulb moment like, wow, maybe there could be an AI solution for this problem I've been facing in my research lab, or maybe there could be an AI solution for this thing that I've always thought about. So I always look forward to that. And I'm sure that's going to happen today. A lot has been said about me, but I want to draw your attention to this image that I have on my slide 1, human in the loop. And I like it because I created this yesterday, and I like this image because AI framing is so important. When we do training and we train committees and groups on AI literacy and using AI for different things, one of the questions that I always ask is, when you think of AI, what mental image comes to your mind? And I've heard lots of responses. I've heard responses like a sneaky intern. I've heard responses like something that comes to learn about your job just so it could take over your job. So I've heard a whole lot. And I've also heard some interesting insight of, we had someone who said, when I think of AI, I think the AI tool gets angry when I ask the same question over and over again. So sometimes when I'm using it, I take a pause and then I take a break and return because I think it gets angry. So I've seen a whole lot of how framing and perception about AI influence how we use it. Because if you frame an AI tool as in the mental image you have about it is that of a smart toddler, then when a smart toddler tells you, oh yeah, I've gone to lay my bed, you still have to go back to check it because you're not sure. So if that's the mental image you have about it, and you look at framing like co-pilot, which I do have a problem with, which suggests that it's comparable to you, can probably do what you do. So framing is so important. In this image, it portrays the AI tool as it takes instruction from you. You can see folding its arm, and then you have the final decision. So it has AI decision awaiting review, and then the human can approve or override. I just thought it was interesting image. Today, I'll talk a little bit about, my goal today is to help you to see what's possible, to just show the possibilities and just get you thinking about, whoa, maybe some of these challenges we've been having could have AI solution. I want to be able to demonstrate what AI can do, because a tool is only as powerful as how much utility we find for it. They do say if the purpose of a thing is not known, then abuse is inevitable. So recently we submitted a grant application, and we were struggling with, I was helping a colleague who were struggling with, the NIH keeps shifting the BioSketch thing. And we're close to submission. We had to figure out how to transfer their reference list from their old ERA account and move it to the new Science CV and all of that. And I was like, wait, there should be an AI solution for this. We should be able to build a simple application in less than 10 minutes that could take all of your reference list and convert it into an RIS file, and then you can export it and share with anybody. And it's like, I don't know. So I said, what tools do you have? So he showed me the tools that I had. I was like, okay, let's try this one. And in less than 5 minutes, we took all of the reference lists and converted it. And that way, any of the collaborators could have that file, and they have the references in whatever engine they use, Zotero, EndNote, and it was just so easy. So I like to show some of the things that is possible that could help increase productivity, save time, speed, cost. And I'll be sharing case studies and also some emerging challenges that we're beginning to see, because AI is like a two-edged sword. A lot has been said about this, but what I like to bring out is a lot of my work focused on, and I think this is where AI is moving us to. Like, there is no, you could see my journey is so convoluted, it's not straightforward. Right now with AI, there is no ready-made training that it's more like you creating your own customized pizza, and saying, this is what I want to learn. So you go taking this training, self-directed learning, which has taken me around a lot of places. Before I go forward, I might not be able to see people who are in person, but maybe those in chat could also do this. How have you mostly used AI in the last 2 weeks? So if you haven't used it at all, you can just type 1 in chat. If you've used it for 2, 3, 4, you could just type 2, 3, 4 in chat. Right now, I would say that it's kind of hard to define using AI because there are two major ways you can use AI. You can use it directly, where you go to a chatbot and you ask your question. But you can also be using it indirectly. You go on your Google Chrome, you type in something, and it gives you a Google overview, an AI overview, which you're not asking for. You're not directly saying, I want to use AI. So there's a lot of opt-out tools that are currently being created where the default is they'll have even Google Scholar is beginning to incorporate AI into Google Scholar. So it gives you a summary. It's going to give you a summary of your literature review, even without you asking. So there's a whole lot of direct use and indirect use going on. One of the ways that most people have used AI so far is this number 3, which I can bet that probably most people would select that, drafting emails and messages, because that's AI works when the things that we do are routine tasks, like you probably write emails all the time, finds a lot of utility for that. A little bit of background about AI. AI simply means training computer models to do what humans would normally do, to mimic human behavior. Going by that definition, you could tell that AI has been with us for a long time. As far back as 1964 to 1966, that was when we had the first AI chatbot, which was on mental health. So AI has been with us. You think about when you call the doctor's office, as long as a task that is supposed to be done by a human is being taken over by computer models, that's an expression of artificial intelligence system. That's why it's called artificial intelligence. You call your doctor's office. Ideally, you should speak to a human, but then they tell you for prescription, press 2. You're not talking to a human, and you do that, and it actually tells, yeah, you can come pick up your prescription. So that's an expression of artificial intelligence. However, what we're seeing an explosion of is generative AI. Generative AI, unlike rule-based AI that will say press 1, or to get your refund, type refund. You have to type refund, and it's very rule-based and rigid. Unlike that, we're having generative AI models. And these allow you to create new content, text, all from learning from a large data set. The other thing that is really, really mind-blowing about generative AI is how you can use natural language to instruct a computer, how you don't need to write codes, and you can tell a computer what you want. I want you to give me the list of all of the ABC around me, and it's just going to give it to you. So that is wild. That introduces the concept of citizen developers, where you can then have that decolonizes the whole AI landscape, where you can then have anybody who doesn't have in-depth tech skill still instruct the computer on how they want it to act and what they want it to do. And it also mimics human creativity, which is wild. And we'll see quite a bit of that in some examples. A little bit about how the AI architecture works. I like this image because when we have a little bit of background of how AI systems work, we can see where the errors are coming from. We can see where it's likely to fail. In simple terms, it works through the process called retrieval augmented generation, which is simply search first, answer second. And how that works is when I go as a user, I input my query into an AI system, let's say my Gemini, Copilot, or ChatGPT, and I say something like, what continent is the United States? It's going to do, number one, it will try to go to its data source, its database, and retrieve that information. So retrieval, which is search first, that's the first thing it's going to do, and say, do I have anything, any training, any information on the continent where USA is? Is there any information in my database? If it finds, let's say it finds, oh, something from Wikipedia or something from Reddit actually says the United States is in North America. So now it retrieves that information. Okay, I find it. The next thing it's going to do is to generate a response, to give me a response to my question. So So it's going to try to figure out, should I say USA can be found in North America, or should I say USA is located in North America, or should I say the place called USA resides in North? How do I generate that response? So it walks through this retrieval and generation phenomenon. And this is where we see lots of errors coming in when you're using an AI system. So if you type in a query, and in the process of retrieval, there are errors that come from that, because if you have poor data source, if you have unstructured data, if you have poor quality data, then it's going to retrieve what is not accurate. Also in the generation stage, if you don't have strong guardrails, so we need what we call double guardrails. We need guardrails at the retrieval state. We also need guardrails at the generation level as well, to be able to say, whenever you're retrieving, do not retrieve from these places. This is how you retrieve. Whenever you're generating, this is how you generate your response. So this shows how we can have responses can be correct. Responses can be, I don't know. Sometimes it says, I don't know, because when it searches the retrieval thing, it could find, well, there's no response to you. If it finds it could give you a correct response, or it could hallucinate because there is poor quality data that has been trained that this is where it is when this is not where the continent is. So these are places where we see leakages, and that is why sometimes you see AI systems are inaccurate and sometimes accurate. Another key concept when it comes to using AI systems is the concept of prompting. I've had people ask questions, would AI take over human thinking? Like, are we going to get to a point where we don't even know how to think at all because we're using AI too much? And I like to say the question can be yes and it can be no. And one of the reasons is because as much as we outsource things, there are two major ways that we could use AI. There is over-reliance, or two extremes. There's over-reliance, where we just use AI and we trust it to do anything we want, where there's limited human involvement and we just believe AI is the best thing, AI is just going to figure it out. That's not a good way to use it. There is also algorithm aversion, which is the other extreme, which is AI is bad, I'm not going to use it at all. Maybe that's also not a too good place to be. But somewhere in the middle, which is cautious use, cautious adoption, critical adoption, where you're using it, but you're also criticizing it and you're critiquing it, and you're also looking for, ways to improve it, and you believe it can make mistakes. It may be right, it may be wrong, and you're using it that way. That's much more like where I am and how I use it. And I do like to say that you can outsource many things to your AI. You can tell it to help you with emails, to help you search for something. But one thing you don't want to outsource is the thinking part. You don't want to outsource the conceptualization, the ideation, the thinking part of that human part of you to it. Because the more of that we outsource, the less strong or the weaker the type of output we would get. So here's an example of a very bad prompt, and I'll tell you why this is bad. When you tell an AI to write something about extreme heat, you have outsourced so many things to it. When you say write something, like that could be write a memo, write a policy memo. That could be write a skit or a script. That could be write a LinkedIn post. The moment you say something, you're allowing it to fill in the gap and figure out what that something would be. So you're outsourcing that part of it to the AI system. So write something about extreme heat prevention. You are outsourcing a large part of this command, this instruction to the AI system to figure out. A better prompt could be write a short Facebook post in plain language. The more specificity you add to your prompt, the better it is. So you're clear about the audience. One of the ways that I've seen AI really great in for experts, I believe that AI augmentation, some people call it artificial intelligence, some call it augmented intelligence, but that augmented part is really, really powerful. This is where, as subject matter expert, I believe that we can use AI tools in a way that it will really reflect all the years of expertise that we've had. When I do AI consultation, one of the questions I hear almost all the time is that, how can I bring my years of experience? I mean, now that there is AI, how can I bring, we've collected data on so many things, we've trained this, we've done a whole lot in this field. How can I bring that into AI? How can I bring that into how I use and how I apply this tool? And I do say that all of that is not wasted. In fact, that's what stands you out. Here is an example of a prompt that someone who is into behavioral health and understand theories can use. So I call this a theory-laden prompt, where you can say, create a 50-word health information resource for farm owners, aiming to raise awareness about bird flu. Apply the health belief model, highlighting the perceived severity of bird flu, the benefits of adopting precautionary behavior. You see that this prompt reflects that I know about the health belief model. This is different from me just saying, give me health information on bird flu or create something for me on bird flu, because AI is introducing what we call reskilling into how we do things in healthcare, in population health, in behavioral work. Reskilling in the sense that AI can do the task of doing the writing, but many people are going to shift their roles from actual writing to directing or to managerial role, where you begin to manage the tool and you begin to direct it to say, make sure you apply the health belief model, make sure you highlight perceived severity, make sure you highlight the benefit of adopting this. So that's me directing the tool, which is a great use of bringing your expertise into how you prompt. Here is a prompt template that also spells out how there is an intersection of the human expertise and in using the tool, where you're saying create a, and then you insert the word count, because you have an idea of what you want to create. And as health communication, health literacy professionals, we do this a lot. You know the best word count, you know the ideal word count that should fit in for a particular target audience. Maybe you're dealing with older adults, or so this is you sitting at that director role, and you're saying create an X amount of word count health communication message for this target population. So you know about your priority population. Encourage them to take up this behavior. Apply this so and so theory, because you know that. So you're not leaving it for you to fill out the gap. And you're saying these are the components of this theory that I want you to highlight. Use it for this social media platform. So these are some of the best practices that we teach around prompting, where you can bring your expertise to augment how you prompt and how you use the AI system. There is also the concept of reverse prompting. This is where you ask AI to prompt you. It's also another way where you allow it to, also called covering your blind spot, where sometimes you want to do something and you've AI could serve as a peer reviewer, where instead of you just going by what you know, you can say, hey, what questions should I consider? I'm an STI prevention specialist. I'm trying to create this program. What barriers, what questions should I consider? Where do I start from? And then it begins to tell you, have you thought about this? Have you thought about this? So you can have, we call it bi-directional prompting, where you can prompt an AI tool to say, give me this, or you can even ask it, I'm going for an interview. This is the profile. This is what questions should I prepare for? And then it begins to tell you, have you considered this? Have you thought of this? Have you thought of this? So it's prompting you. That way you're forced to still think through the responses before you finally decide on an output you're trying to create. With that being said, AI introduces so much possibility. You talk about speed, creativity, insight, multimedia. Before before AI, during my postdoc, we tried to build a dashboard, and we spent about 6 months building it. We had a full stack engineer, we had a UI UX team, we had we had a content team. It took us about 6 months to create the initial prototype, because we also had to review it. And then with AI, when I was trying to recreate a similar dashboard, very similar to that, it took less than 20 minutes to recreate it. So you talk about speed, cost, insight. And then there are AI tools that, because we were having humans review the dashboard, they would have meetings, we review, say, oh, change this color. But now you have AI tools that would assess your web page for you, and they'll tell you the issues that are wrong with it, and they'll tell you how to fix it, and they'll tell you issues with accessibility, these colors and these colors don't match, like things that humans may not even think about. So much creativity, insight, multimedia content. Will get to that agentic solution as well. Here are some of the AI tools that you probably have heard about. And these are some popular ones that we use in health communication. A little bit about AI tools. I'll say, personally, I probably have access to, I don't know, maybe 50 different AI tools that I use for different purposes. that I'm subscribed to. I'll categorize AI tools into three buckets. I think there are some that are general purpose AI tools. Think about them like your ChatGPT, your Copilot, your Gemini. You go to them for general things. They are like your primary care physician, where you go to them for everything. And then they can refer you to a specialist and say, oh, you need to see an OBGYN, or you need to see a dermatologist, or you need to see a cardiologist. So there are general purpose AI tools, which is usually a great place to start, where you can say, hey, I need to do this. And then they will tell you where to go or what other tool you need to go. And there are purpose specific AI tools where this is their primary thing, just like you have your, dermatologist. This is their main training. Of course, they can answer questions on other things, but this is what their primary purpose and what they're created for. I'll run through a few of them. Your Perplexity AI, for example, this is really good for research, text-based. It gives you citation for almost anything. If you say, tell me where to get the best restaurant, whatever response it gives to you, then it's going to give you the citation for it. Like, this is why I said this. There is a blog that said this is the best restaurant, so that's why I'm calling it the best. Its level of hallucination is minimal because it gives citation, but then it draws its references from all sorts, from blogs, from social media posts, from scholarly work. It draws references from multiple sources. Elicit, on the other hand, is really great for literature review. In my own experience, I haven't experienced hallucination in any of its outputs. It's largely accurate to a great extent. It's usually good for literature review. The difference between Elicit and Perplexity is that Elicit would only draw a source from scholarly work. It doesn't draw from blogs or from anything. It only draws from scholarly work, mostly peer-reviewed. But then that also introduces some bias, like how does it prioritize what article to draw information from? So there's quite a number of them that have specialty tools. So I've talked about general purpose tool like your ChatGPT, your topic specific tools, specialty tools like your Perplexity and Elicit. Then the third category I would say is concierge tools. These are tools that when you subscribe to one of them, they have about 20 different tools that they give you access to. An example is this design AI that we have here. When you subscribe to it, and the beauty of that is when one of the tools stop working, you can always switch tools. So those are some, because more tools will keep coming. So those are just some considerations when you're thinking, what do I subscribe to? Which of these tools do I subscribe to? A little bit about AI in healthcare and how patients are using AI, how healthcare professionals are using AI. A recent ChatGPT report shows that more than 40 million people use ChatGPT for health information in a week. 3 in 5 adults in the USA, they've used AI tools for their health or healthcare in the past 3 months. This is really, really well. And the chart to my right, I like to talks about how 1 in 3 adults have used AI for health information. But then I like to point your attention to how we're beginning to see that more people are saying they trust AI tool compared to social media. So you see, for physical health, 29% say they would use AI tool, while 24% say they will use social media. So we're beginning to see that trend. There's increase in the use of AI chatbot where someone needs health information and that's where they go. And that's going to be one of the challenges we'll discuss about, which is the issue of discoverability. So right now, if people are turning to AI chatbot for their primary health information source, how discoverable is the information we've put on our website? Can it be found on AI chatbot? Can AI locate the information? Because right now there's a whole lot of how you structure information is how it's gonna determine if it will be found on AI systems or not. For physical health or mental health, 32% said they would rather go to AI chatbot versus 29% who said they will go to social media. Here is also an interesting variable on who uses AI chatbot. We see that for uninsured, people who are uninsured say they are more likely to use AI chatbot for searching for physical health information, 31% versus 28%. And also almost, more than double said they would use AI chatbot for mental health versus those who are insured. So 30% of uninsured say would rather use AI chatbot for mental health issues versus 14% of the insured. And this is not so surprising because insurance is a big thing. So when we talk about health accessibility, to healthcare, and then AI is coming to fill that gap. It's just not so surprising that we're having this as a big factor. Now I'm going to show you some use cases on how we've been using AI in health communication and at my research lab, and this could help, spark some ideas on, oh, maybe this is also possible, or things to consider. Here is an AI tool that we built in less than 24 hours. Yeah, less than 24 hours speed. And what this tool does is that it takes complex publication, peer-reviewed journals, and then you can input it into it, and you can select your third grade. So you could take a cancer publication, and you can select and say, give me this information in third grade, and then it simplifies it for you. For example, for this, the original title is Advanced Cancer Immunotherapy Research. And then when you select third grade, like simplify this text, and this publication gave it to me. Third grade, it says new ways to help the body fight cancer. So it gives you, this is what it says originally, and this is what is simplified version. The goal of this, like we know in health literacy, in the definition of health literacy, there's a big part of it, which is how do people understand health information. So this is a really big deal. The other one that we're working on, again, this was also created in like maybe less than 48 hours, the initial draft of it. What this tool does is that it allows you to input your local food nutrition label or any nutrition label. Sometimes you go and then it simplifies it for you. Sometimes you go to the patient will go to the physician and they will tell you, hey, you have to reduce your cholesterol, don't eat so much of pizza. And if you're like someone who eats lots of international food, you're wondering, but can I eat so and so food? And your physician, I don't know that food. Like, I don't know that food, but just stay away, like cut down cholesterol. And you're thinking, this local food that doesn't really have to say have high cholesterol, how do I tell? So this tool allow you to upload your, so stage one, you upload the nutritional label or the food, and we're working on it to even, there's a new tool called Ideogram AI, which I have here. The version 4.0 was released like a few weeks ago. And what it does is really amazing. I think it has a great implication for people who work around nutrition, because you can take the picture of your food. Let's say you're thinking of diabetes management. You can take the picture of the food and then it's going to analyze it for you and say, based on this image, this is what you're eating based on this quantity. If you have like a reference image that you put in front of it, maybe you put a cup, so you can say, okay, based on this reference image, it looks like you're eating this quantity of this food, which is estimated to have this number of calorie and sugar content, and then it can give you that estimate, which is near accurate. So you upload your image, it analyzes the nutrition for you, and it simplifies it. So you can say, explain what this means in 5th grade. And then it can tell you, this is what you have in your snack in simple terms. Calories, too many of these. If you have 200 of this weight, is okay for you to treat. And then it can give you eating tips on, this is probably how you should consume this. So the goal of this is to simplify what has been complex, and also make it more acceptable, encourage more food type. Another tool that we've been working on, I would explain what this is actually doing. This is another really, really great tool. The goal of this is to help anybody. Let's say you work at the health department, you're not a hardcore researcher. It can allow you to still create theory-informed messages. So in step one, you select and say, I don't have a theory in mind, but I want to create a theory-based message. I want my message that I'll create should be theory-driven. So you can select, I don't have a theory in mind. Step two is that it's going to tell us about your health message. What's the desired behavior you want to see? Say, okay, the message should be about physical activity. I want people to walk for 15 minutes daily. And the key insight is my audience have limited time. Say, okay. When you select that, you say, get me a theory suggestion, then it's going to give you suggestion. Like from here, it's saying you can use the theoretical model, and this is why this theory could fit your messaging. You can also use the health belief model, and you could use the social cognitive theory. So these are the 3 types I'm suggesting to you. And we use this internally sometimes in our message creation. So if you select one, let's say I go with the social cognitive theory, then it gives me what format do you want it, which is step 3. Do you want a blog? Do you want a Facebook post? Do you want an Instagram post? And once I select, it generates the message for me. And then it tells me what components of the theory that it's using. Oh, I used this variable to help you draft this. I use perceived self-efficacy. That's why I said this in the message. It also analyzes the message for you on CDC Clarity Score, reading, readability, literacy level, cultural sensitivity, and it says, hey, and it gives you a recommendation to say, hey, your message is really, really very doing poorly when it comes to cultural sensitivity. You may want to consider improving it. And you do all of that before you choose to push your message to different sites. So I think these are some of the ways that we can apply AI in doing this. AI can also be used as a monitoring assistant. For about since 2021 during COVID, a lot of my research was around tracking the spread of health misinformation and in communities. And we had a whole lot where we're tracking it every week from community members. And then when AI started becoming more and more thin, I decided to set up like a daily task, or you could do a weekly task where you can say, hey, I need you to run every morning at 8 a.m. and I need you to search the CDC website, search so-and-so website, and identify the top 5 trending most relevant public health updates and deliver it to me. And this is how I need you to deliver it to me. Give me the topic, give me a table with the topic, give me the plain language summary, give me why it matters, give me the source so I can track it, and then make sure it's compatible for professionals to learn from. And then it does this every morning and just give it to you. And every day it goes through the site. So you could actually set up a misinformation tracking system. And you can do this with your regular Copilot or your ChatGPT. If you take this prompt, for example, and you fill in what you want, and give me information on physical activity, on misinformation around this, from this so and so and so website, I need you to give me a summary. So this keeps you abreast, you know what's going on around you. You have information intelligence. So this is one of the ways that you can use it as a monitoring assistant. And now there are also utility for it when it comes to AI for creating multimedia resources. We have seen, I would say for my lab, this is probably where we've seen the greatest demand of people wanting to create tailored precision health communication resources. Here is an application of AI for bird flu prevention, where we created this comic and we did a publication on this as well. And the goal here is, this was when bird flu was very topical, especially for those who have backyard farm owners. And then we're able to rapidly create this in less than 2 days. The image, the scripting was done, human oversight, of course, but then we used AI as well. We did theory framed prompting. We used that concept here. The image was designed with AI, and then we're able to test it. We're able to test this material when it was released, the resource material. And we tested among 100 participants. One of the questions we asked, what is your most liked feature? About 39% said the simplicity of the message. It was just so simple. We also asked questions around perceived message effectiveness. On a scale of 1 to 5, we had a mean of 3.8 of perceived effectiveness of something that was created with human oversight, but in conjunction with AI. So this just tells that there is a huge possibility that you can create an effective message if you master the act of prompting correctly. We can do a whole lot with AI support. Now I'm going to play a multimedia I'm going to play this multimedia that we created with AI. I would like if someone can please confirm if you hear the sound from this. Did you hear any sound?
Yes.
Okay, thank you. I'm putting it on 1.5 speed.
Imagine seeing a realistic image or video of someone you know doing something they never did. This is not science fiction. This is the reality of deepfakes, and they are being used to harm people in our communities. Deepfakes are images, videos, or audio created or altered using artificial intelligence to make it appear that someone said or did something they never did. Although artificial intelligence has many benefits and positive uses, it is also important to understand the risks, including how it can be misused to create deepfakes. When these images are sexual or shared without consent, they become a form of image-based abuse. This includes both real images and AI-generated content. To understand why this matters, we need to look at what the data tells us. 99% of sexual deepfakes are of women. Globally, 57% of women report experiencing image-based abuse, and 1 in 3 people identify as victims of image-based abuse. These harms cause real consequences. Survivors experience fear, shame, isolation, loss of employment, and ongoing threats. Deepfakes are increasingly used as tools of coercion, control, and gender-based violence. It is important to acknowledge that deepfakes are becoming harder to detect. Technology is advancing quickly, and it can be difficult to tell what is real and what is manipulated. That is why awareness and caution matter. If you are not sure an image or video is real, pause before sharing it. Look for possible clues such as odd lighting, warped hands, mismatched shadows, or faces that look unusually perfect. And remember, no single sign is enough on its own. There are also tools and resources that can help build detection skills. These include deepfake detective quizzes that help people practice spotting manipulated content, and image checking tools such as the Deepfake-O-Meter. As community leaders and service providers, awareness matters. If someone discloses image-based abuse, believe them. Do not share the content. Help them document evidence and connect them to trusted local support services. Deepfakes spread through sharing, but they stop with informed communities. So let's all stay informed together.
Okay, so this particular tool was created in response to a county where they asked us to create something for young people and education around deepfake and sharing on image-based abuse and things like that. So we're able to create that with AI. So small of AI for good and AI's utility in multimedia generation. I'm going to share another video.
I thought it was just headaches until they said preeclampsia. I wasn't checking my pressure. I didn't know it could, like, take you out. Now I check. I act, and I'm here.
So for this particular group, they told us that they've spent a whole time collecting qualitative interviews from around issues around maternal and child health, postpartum depression, and now they want to take those stories and they want to make it real. So they wanted us to help create multimedia that would help retell these stories without using the actual images of those who told those stories. So we started working with them on how can we take the stories you've collected, how can we move it from just text and interviews and move it into something that is more actionable, which was why we started working on that project. Then I'll show another one.
There's no scientific evidence that Tylenol causes autism. Major studies and health agencies confirm it's safe when used as directed.
I'm showing this to show that AI is not just for animation or cartoon. AI can also be used for realistic images where you can have a real human. And I think this is some of the things we'll start seeing in the future where professionals will start building, and I mean, some people are already doing that. I'll show in the next, where they'll start building their AI avatar. And let's say I need to say something, and there's going to be my official AI avatar, and I need to say something, and I'm not in town, I need to respond to, similar to what we had during COVID, where the landscape of health misinformation was changing at the speed of light, so that it's almost nearly impossible for any human to keep up and keep debunking and pre-bunking some of those things. We could just have your AI avatar respond in real time, which is why this could be a possibility. And the next one, this is...
No hablo español, pero con inteligencia artificial, quizás puedo intentarlo.
So this is my AI avatar that is trained to speak Spanish. I don't speak Spanish, but then I'm able to make it speak Spanish. And I have a colleague who does this. She's a nurse and she has her AI twin or her AI avatar, and she delivers health information messages in multiple languages that she doesn't even speak personally, in her voice, in her, so like think of how that the implication of that for information access for patients as well, where there is maybe a professional or healthcare provider that they already established trust with, and then is speaking their language. It introduces a whole new level of persuasion and maybe comprehension as well. So that's another example. The other way we've been using it a whole lot is what we call character-based health communication. This is us. We have an ongoing project in Uganda currently, and Uganda Cancer Institute, the problem they had was having to provide information around. So they have treatment abandonment where parents in the pediatrics oncology, parents come and they probably learn about the diagnosis for their children and they never return. And there are several reasons responsible for that. So some come back, some don't even come back to get the result. Some come back, and when they hear the result, they don't come back. So there's leakages at multiple points. The healthcare providers, they are overworked. That's the only cancer institute in that region. And people come from all over. So there's a lot of overwork, overburden. So they just have a PDF that they give to parents to go read. But they realize some don't read it. So they wanted us to build a video library that would convert the information on the PDF into, maybe chapter 1 is what is cancer. So that would be like a 3-minute video in the library. Chapter 2 is maybe how is it treated, something like that. So then we'll build a short video on that. So there'll be a video library such that the video library will be engaging. It will be delivered by a character called Nurse Grace. So we've been doing a lot of work on this. That's what you have to the lower left, and the Nurse Grace character. And we're doing that from here. Traditionally, if we were to do this, we'll probably have to go to Uganda. We have to find a Nurse Grace character. But now we're working with a team over there, and they're able to tell us this is what the nurse's uniform would look like. This is what the voice will look like. This is what this will look like. And then we're building this character, and she's going to be delivering health information with the cultural way, with the accent, with everything, all from here. And we're working with a team at WashU and also the Uganda Cancer Institute and KUMC Wichita. We're also applying this character-based health communication to the immigrant population here in Wichita. And for example, we gave them this collage we have here. We gave them these 4 different characters, and we say, hey, which one do you think should be the primary information delivery? And then people chose the one that has the yellow tick. Like, this is what we would like the person to look like. So this character is going to be delivering health information on different topics every week. So we could talk about blood pressure today, could talk about physical activity, could talk about vaccination and things like that. And we want to test elements like character identification and character transportation. For this one that we're doing in Uganda, during one of the script reading phase, one of our team members was actually crying. She got really teary because it was so emotional with how, and she works in the Cancer Institute. So she was like, this is what I hear every time. And we're using AI to create this. But it just shows that there's a way that we can still impute the elements of emotion and induce that character identification and narrative transportation, which are key drivers of persuasion when you're doing narrative health. So we're seeing more around that.
Hey, everyone, and welcome. We're diving deep into breast cancer screening today. Straight from the source, we've got guidance from the CDC. Those guys, they're known for giving us that clear, reliable health info, right?
Absolutely. Yeah.
And our mission, it's all about making sure you have the knowledge so you can make those informed decisions about your health.
That's it. That's the goal. Yeah. Knowledge is power.
So this is AI for podcasting. We created this, we created this 30 minutes podcast in less than 5 minutes. And all that we did, so I'll say it again, we created a 30 minutes podcast in less than 5 minutes. It's only possible with AI. And all that we did was we took a link from the original source, which is, I think, the CDC, the announcement that was made on their blog on breast cancer prevention and the new guideline. And we input the link, that was all. And then we need a podcast. And it's able to give us that information. And you can hear the 2 voices, which sounded like 2 people. Those are not real people, they're all AI. And it sounds like 2 people are making this conversation about the topic. So that's also another possibility of The goal is that there's usually no one size fits all when it comes to health communication. There are people who like to get their messages in podcast format. There are people who like to get it in video format. And traditionally or humanly speaking, manually, it's hard to give everybody messages in the way that they would like to have it. But we're seeing that that is becoming more and more possible. We've also used AI to create topic-specific chatbot. If you go to your ChatGPT can answer questions on anything, which makes it more susceptible to mistakes and errors. But with topic-specific chatbot, we're building chatbot that can only answer questions on so and so. So we have a menopause chatbot that can only answer questions on menopause only. And we did a test on this. We did an expert validation on this. We asked experts to rate this chatbot on 5 indicators: safety. How safe is the response? Consensus, how much does it agree with existing guidelines and standards? We had physicians rate it, and it scored pretty good. When it comes to questions around symptoms, it was rated on a scale of 1 to 5, 4.57. Issues around treatment, 4.0. So, and this makes it possible to build, so you can build AI chatbot on your own resources. We controlled where it pulls information from. So for this chatbot, we're able to say you only draw information from these sources, which is why it's kind of high. We also did a breastfeeding chatbot, and for this, we compared the output of a breastfeeding chatbot with the general ChatGPT and Copilot. And something to note here is we trained our breastfeeding chatbot on just one source. We used the Office on Women's Health breastfeeding document. That was the only document we used in training it. And it still did a little bit better than some, the rating of it, where we had lactation consultants, 3 lactation consultants who rated it for safety, consensus, and all of that. And then we compared it to ChatGPT and Copilot. When it comes to safety, our in-house chatbot was rated 3.6 on a scale of 1 to 5 versus ChatGPT response, which is 3.4. So, and then we have some that are significantly different, like our AI breastfeeding coach was rated 3.72 on consensus, which is how much it agrees with popular standard, versus 3.5 for ChatGPT. Again, we only trained it on one document. So it was only allowed to pull information from one document. So if we had included more things, it would have had more sources to draw from. So that's kind of encouraging that even with training it on one document, that we are sure that this is accurate. And this is one of the ways we can also begin to address misinformation, where you can, when I was talking about the retrieval and the generation, where you can decide where it retrieves information from. And you say, only draw information from here. And finally, I'm going to show you our most recent project, which is building AI agent simulation. And the goal of this is so traditionally, and what we normally do, the goal of researchers is that we want to be able to draw inference from a subset of data. So I want to do a program for the city. In the city, maybe we have 40,000 people. I need to know if these 40,000 people, if my program would work. I can't interview all the 40,000, so I take a subset or a sample. And then I interview, maybe I do my collect data collection from maybe 100 people or 200 or 500 people. And then I draw inferences from that to tell, okay, based on this 500, I do my sample size calculation. I think it's gonna, this is where I should go. So the whole goal of research is we want to be able to draw inference from a sample and then apply it to a larger population. With this agent that we're building, it allows you to simulate an entire patient population or a city. And then you create personas where you don't have to go to actual people, but you have a representation of each of those people and in your AI simulation agent, and I'll show what that looks like. So first, we have 3 groups of people. We're simulating a patient population. So we have 3 groups of patients. Number 1 is Alex, an Alex type of patient. This is a patient who has transportation barriers. They lack reliable transportation. They rely on unpredictable public health transit and rides and all of that. And then we have a Mrs. Evelyn type of patient. This is a patient who is an elderly patient, age 78, limited social support, they live alone. So we describe them, we create a persona for this type of patient. So it's not just one patient, but this type of patient. And then we have Jordan, who is highly adherent, follows healthcare recommendation. Next, we build this AI simulation where we bring these three group of patients into a space. We define the population segment. We write rich person about them. We do literature review. We actually had to find out what does an Alex type of patient look like. And then we're able to have some scholarly work that establish what this type of patient will look like. And then we design the space and we test for believability. And how it works with, I am the researcher, I'm called the director. So I go into that simulation environment and I begin to type to say, discuss the barriers to follow up, or how would you react to this social media post on physical activity? What would you say to this post on nutrition? And then the agents, which is all of those persona, the Alex, the Miss Evelyn, they will start to share their conversation with me. Here is a screenshot where I said, so I took a post from the CDC on physical activity where they say physical activity can make you feel better, function better, and sleep better. So I look at how my agents are reacting to that information. Alex, who has always had challenges with transportation, is saying, I hear you and I want to do the right thing. I just need it to be easy and close by, because between picking up the kids and work, I don't have a lot of room for extra steps. That is his reaction to that post. What this simulation agent does is it helps you to test your messages before you release it to the public. It doesn't predict outcome. It gives you believable outcome. It helps you to see how different audience segments of the population could respond to your message. And then we have Jordan who responded by saying, I always say, if you are unsure, schedule an appointment and ask. And then someone responded to Jordan and said, Jordan, you don't need an appointment to do a physical activity. And then Jordan responds and says, oh, that's true. That sounds like something I have to plan ahead. So this is also a way of thinking of your focus group discussion, how you can have your agents interacting and looking at what that natural conversation would look like. We're evaluating this in two major ways. We want to compare human response to AI agent response. We want to give people, and they're blinded, they don't know where the source is, and we say, which of these response do you think is coming from an AI agent? Because we're doing, so that's what we call a believability test, where we want to test, can AI agents accurately deliver believable conversation, believable outcomes that can be useful? Because if it turns out that more people are saying the AI agent's response feels like the human response, then we have to start asking questions around message creation. Should we be looking at how we can better use AI to create believable messages and increase things around persuasion? The other way we're testing this is through different levels of correlation studies, where we want to be able to get real people. We want to ask the same question from our agent. Let's say, how would you respond to this? And we ask all the three agents, the Alex, the Mrs. Evelyn, and we ask the same question to real humans. And then we test, we do a correlation. So if we say, Alex, our agent, Alex, how likely are you to attend so and take this flu vaccine? And Alex says on a scale of 1 to 5, I'll say 3/5. Then we ask real humans who share persona with an Alex, how likely are you to take this vaccine? On a scale of 1 to 5, and they say 3.2. We see that means humans are rating things similar to how AI agents are rating those things. If there is high correlation, then we begin to think, where then is the role? Are we building AI agents that sound so much like humans? Does that mean that we can have AI agent answer some questions for us before we even go to humans? Because when we collect data from humans, very rich, and I think we should always do that, because you want to make sure there's strong human oversight. But some of the limitations is that if I give you a survey, for example, even if it's a longitudinal study, I'm limited to those time points where I collect it from you. I can't wake up in the night and just say, oh, I also wonder how they would answer this other question, because I already collected data from you and the participant is gone. But with AI Gen, it allows you to do in real time, interact with your participant, in real time. And you can say, okay, let me also test how they respond to this. Okay, what if I take up this part and I replace it with this part? How are they going to respond to this? So those are some of the things we're thinking we'll be able to do with this. Some basic guideline and consideration when using AI biases. AI systems are very biased. They are biased based on the data set they are trained with. While most AI companies don't reveal the source of their data set, but there is anecdotal evidence that a lot of them have about 22% of your ChatGPT is trained using Wikipedia, which brings about the question of what are the dominant voices on Wikipedia? They are most likely to be reflected in the outputs that you also get from the AI machine as well. It also brings about the question of discoverability. When you have your Google Chrome and you ask a question and it gives you AI overview, there are some studies that have shown that about 50% of people do not read past the AI overview when they ask health-related questions. So that brings about the question of how does the AI tool determine whose information is featured in the overview? Like, are they going to choose from my blog? Are they going to choose from how do we ensure that our own information, like I don't want to do a program and I have an event and I put it on my website and my priority population are going online to search for it and it's not featuring mine. So some of the battles we will start having will be the battle of visibility. How are organizations prepared to start structuring, because there are processes to actually getting your work featured on AI search bots. There are ways you can get your organization information featured on ChatGPT if data is structured accurately, but it's going to involve a lot of restructuring. And if we leave it just the way it is, and more people are going to AI chatbot, then it could reduce that discoverability. Also, the issue of privacy, big deal. Human oversight should always be prioritized. And transparency. In some of the videos that, like those that I showed, sometimes we're very clear about this is what we did with humans, this is what humans did. So we do disclosure. We don't just say this is an AI generated video, because that's not absolutely true. So we say AI did ABC, the image, the audio, that was from AI. But then the humans did ABC. So such disclosures may also be helpful. And here are some resources that could help when you're building AI solutions that could help you test how much ethical this is, or ethical consideration. I really like this. It's a free tool that can be downloaded. We also see that institutionally, some organizations are beginning to have, beyond IRB, they're also having ESR, which is Ethics and Society Review. So when you're doing work around AI, the IRB reviews it, but also the ESR also reviews it. Because the type of challenges that AI type of work could introduce could be different from, you could have research rigor and risk to human, all of those checked. For example, an IRB would check risk to human subjects, and ESR would check risk to human society. Those are some of the differences. And those are institutional changes or institutional considerations that could be made around AI ethics. We're always open to collaboration. Like I said, AI really works well when there is subject matter expertise work together. Domain experts work with the AI expert. This is where you get like the best out of it, because that way domain expert has so much wealth of knowledge and they could tell you, hey, this is what we want to do. This is the problem we've seen. Is there a solution here? So when we do some of this AI consultancy, like for the nutrition thing, was really influenced by when one of my colleagues who does a lot of work around nutrition, and then she just said, what do you think around this? What solution can we create around this? This is one of the problems we're having. I was able to say, oh, okay, let's see if we can create this. So I think bringing that synergy of experts and AI experts and domain experts coming together would really, really bet something really great. So thank you for listening. That's all I have.
Well, thank you very much, Dr. Logicki. Let's give it a round of applause. We have a nice. Please feel free to ask questions. We'll start with people online while we get the mics set up in person here. So online, if you have any questions, please unmute yourself and ask away. If there are none online, we'll do some in person.
Hey, thank you for that talk. That was wonderful. My name's Jay Robertson. I work at Children's Mercy in Sports Medicine. I got two questions that are very different, so I can just do one and then pass it on to somebody else. But first one is, do you have any sense of whether, like the social media posts and stuff that you talk about making, if you have more engagement with those on AI videos than you do with just people, talking off the cuff who are just physicians or nurses or physical therapists or whatever?
Thank you. Okay. So we haven't done direct. We're in the process of collecting data, like for the deep fake. We're meeting with stakeholders. We have the Attorney General's office, sheriffs. They're answering questions around things around persuasiveness and all. But we haven't collected social media metrics. But here is one of the emerging trends that we're seeing, which is some of the predictors of maybe behavior change, especially around narrative health. We're already seeing those. So those are most of the things we've collected, things like narrative transportation, things like persuasion. Those are some of the things, but we haven't really tested it with direct behavior change around that. And also we haven't really done more of the social media metrics. What we're planning to do around that is for the character-based health communication. We really want to have this as we're getting someone from the community, and her role, we'll be using social media largely for that. She's a resource navigator for an immigrant population. So our goal is to build her character, and then she'll be delivering information, and then we would go really live on social media with that. So hopefully we can get some engagement from that.
And then my other question was, isn't there a risk with making all this content that eventually AI just starts looking at the content that's already made with AI, and then it's just regurgitating itself all over the place and not really coming up with any new insights or information from actual healthcare workers?
I think that's possible, though rare. Like I talked about the prompting. So one thing about the retrieval augmented generation is anytime for the retrieval part, it goes to retrieve. For the augmentation part, anytime you introduce new information to it, then it augments its database and its knowledge base. So there's always this renewal happening. Also, if you prompt accurately, the more you know, the way you use it is going to depend on the output you get. Let's say today my knowledge about prompting is just give me theory-based information on, exercise or healthy eating, and I prompt it that way. And tomorrow I've read some other things and I see it's not just enough to say give me theory-based. I should say give me theory-based and emotionally laden information. So I prompt it that way. So it gives me a more updated output, which is why I said, depending on how you use it, it could really, really be, I would say it's difficult for it to just keep regurgitating itself. If you're using it in a way like, give me something on this, if that's how you're using it, then there's a high chance that it will always regurgitate itself. But if you evolve in how you use it, then it's going to evolve in its responses. Does that answer a little bit? Yeah, thanks.
Yeah, that's a great question. And I've, started using AI more for my work, and I've learned you have to be very specific in what you're asking, source it, and be very clear on the output. And it does improve the prompts or improve the output just so much more. And I was wondering, you had some great, like prompt templates. in your presentation. Are those available, or do you have a source that you send people to kind of where they can maybe find some of those prompts themselves?
That's a very great question. You're like the third person that is actually asking that we build a prompt library, like on different topics. Yeah, I can give access to those ones that I shared, and you may be able to use them along that line. But true, I think this is one of there's a whole lot of things that are needed right now, which is why I'm so excited I'm speaking to you, to your team, because right now we need a prompt library. We need prompt library on specific topics. We need people who have been prompting in a particular way to share how they've been prompting on X. This is how I've been prompting on smoking cessation. This is how I've been prompting around this, and to make it public and others can copy it and, like get similar output. But for the ones that I shared here, yes, we can definitely make it available.
Great. Thank you so much. There's a couple questions in the chat. Feel free, if you're still online, you can unmute yourself and just ask your own question.
I can take some. I have a question here on the effectiveness of realistic versus animated and avatar videos. This is really great. What we've seen anecdotally is that there is a theory called the U-Canny, which says that because AI, right now, lots of AI tools, when it comes to using them for realistic images, they have what we call AI artifacts. So you can almost tell sometimes that this realistic image is not looking too real like a human. Sometimes you can tell, many times you may be able to tell. So that's why many of the things that we create are usually animated. We don't want to get people distracted by creating something that looks so real and is not too real, and they are so distracted by the details of, is this true, is this not true? So we just sometimes we go 3D animation or anime. It also depends on the population as well and the health topic. For example, the video I showed on deepfake, because it's a sensitive topic, it's really hard for us to use real human realistic. So we went all animation into that, which allow us to still portray the message without going too graphic into the human part of it. So yes, it depends on the population. It also depends on we wanting to minimize the noise around that.
Great. Any other questions online?
Yes, we have one that
There's
says
one
this-
about the huge number of apps that are embedded with AI, and it's likely that patients and providers are going to have a hard time choosing between the hundreds of different tools. And how would you choose which of these to use with a given patient or group?
This is very important. When we do some of our AI consultation, we hear this a lot, especially around mental health, where there are so many tools now, chatbot that will say, you can use this to improve mental health, you can use this on depression. The chatbot is leading people to do so many things. So right now, I think organizations are in that place where they're asking, what should we look out for? What should we ask a vendor? Because every vendor will tell you, AI tool, let's integrate it, it's going to do ABC. So I think those are some of the top questions that are being asked now. I would say issues around security, data security is extremely important, extremely, because healthcare is a high-stake domain. I believe that different healthcare field need to start coming up with guideline of what is acceptable. What is acceptable for any vendor? What is the minimum standard if any vendor is going to be giving us tools around this? What should be acceptable? And I think this is where the conversation should be going right now, because if that is not well defined, then you're going to have vendors build things off, anything. And then we may fall in that place where we say, no, we don't want anything, or we go into the just accepting what we get. So I think those are the conversations we should start having. But privacy, data security is a big part. High-stake domains like mental health, these are real areas where we want to make sure we have strong guardrails How does it respond when it doesn't know? What are the sort of guardrails you've built around retrieval? How was the data structured, and what's the source of the training data set that you're using to build this? Those are some questions we want to start asking vendors. You have to be transparent with us. For all of the AI tools that I use, for example, for my work, we have the KUMC IT security. Each of them probably took like 3 months for them to review it. And they had to even call some of the vendors to say, would you take off this feature or would you replace it with this feature because of security risks? So I think inviting experts, creating strong policies, working with IT in our institutions to say this is what is acceptable or this is what is not acceptable. Someone has to do that job. Someone really has to do that job because it's gonna, like you said, there's gonna be so much more tools coming up in the future, and we need to establish what is acceptable and what is not.
Are there any more questions in the room? Yeah.
My name is Shirley, and I work with Head Start. And so you had put on there for a collaboration opportunity. And I was wondering, so Head Start is falling short with children right now of being in centers and also with teachers. And I was wanting to see, when you say collaboration opportunities, is there a way that we could like um, somehow with an AI looking for teachers in different areas or looking for children as an maybe an advertisement or of some kind? I'm not quite sure if that's possible, but it just seems like we're advertising it in colleges, we're advertising it in different ways. I don't know if this may be a different means, but I'm not quite sure what that would look like for you.
Yeah, I really like that question. What I'm hearing you saying is what sort of solution is available for addressing issues around limited teachers and having students, connecting students with education. One of the concepts of what AI has come to do is what we call citizen developers, whereby solutions can be built by almost anybody. I'll give a quick example. I have an 11-year-old, and when he was 10, he created a math. He used AI to create a math app, and the math app runs for kids from K to 12. And at that time, he was in 5th grade, and he was building a math app, and he was able to build it for his own learning experience. He said he likes to listen to music when doing math, so he made sure that the app had music, background music playing or instrumental. And that, when I saw that, for me, it made me think that the disruption that AI is introducing into education, into healthcare, into some of this field, how can you have a 5th grader build a math app for K to 12, and then he could choose the curriculum that he wants it to draw from and to learn from? Like, the level of disruption is really something we probably have not seen before. It's unprecedented. So this, when you were talking about this, it made me think of what if some of the solutions to the scarcity is to start having organizations build teachers, use AI to create teachers to augment, not to replace, to augment what we already have. And I'm happy to chat around some of those solutions and what that will look like in real time. What if we start building curriculum and we start having self-explanatory tools that would, incentivize and improve learning? I'm happy to have that conversation after this. But really, I think the future of education is shifting. I don't know if you read in the news of some of these learning platforms where ideally they provide teachers, and they had to shut down because they said people would rather go to AI to learn. Like, they're already asking, why should I pay this amount for education when I can learn the topic from AI? And we need to get ahead of that to see what will it look like if we adopt AI and then we augment with the available humans, where humans still have a lot to do. We need human in the loop. We need human supervision. So it's not going to be just an AI tool. And then we are using the available humans, the available teachers we have, and we can help them to get some training, but then their role would be more of managerial, where they are managing the AI systems while the AI system is delivering the education. And then their role is to make sure the systems are delivering accurate education. I think that is more of what we'll start seeing in the future. And I'm happy to chat more about some possible solutions around that.
Any other questions in the room?
Does she have an email?
Yeah, so that's what I was just going to ask. So what is the best way to get in contact with you?
Oh, okay. I can put my email in chat or
Yeah, and we can also, oh, yeah, great. Great, thank you very much. I guess the final question I have for you is, AI it's been around for a while, as you showed, but it's still very new for a lot of people, and it can be intimidating, I think, for a lot of people who have spent their career learning in a certain way and doing things a certain way. Do you have any recommendations for if someone is naive to these generative AIs? What's the best way to get started? Should they just get in and start exploring on ChatGPT and, drafting an email, or do you recommend other things?
That's a very great question. And I'll give my recommendation in 2 levels. First, I think there's a role for individuals to play where they can start with, a popular tool that is safe, maybe approved by the institution, and they can start with simple things based on how comfortable they are. We talk about the diffusion of innovation theory. We'll always have the early adopters, and we'll have the people who would be slower and, just take their time, which is really good as well, because they help to pull us back, those of us that just dive in. Like they help to check us. So I think there's a role for individuals on their own. But I also think that organizations, collaboratives, groups also should consider options like building on-demand resource tools for their team members. I think there is a place for enterprise to step in and create these on-demand tools that is especially also tailored for the members of the organization. Because you can go to learn about AI, but if I'm a physician, I need a different knowledge from if I'm a marketer. Like I need something specific to the things that I do in this organization that will help ABC work that I do. So I think these are probably some other things that we've helped organizations do, which is how do we build on-demand library for your organization on what is important for you to learn on context-specific AI learning. So at the individual level, yes, you can, try on your own to do this, but I think collectively we can also do much more. And we're very open to helping get that done as well.
Right. Well, thank you so much. Let's give another round of pause for Dr. Olugoke. Thank you so much for joining us from Wichita this morning.
Thank you for having me. It's a real pleasure.
Great. Thank you. Okay, we will. Kelly's going to help me get everything back to starting. We've got just about 10 more minutes. Okay. Great. I hope you enjoyed that presentation. I certainly did. Like I said, that's the second time I've seen it now, and there's just so much to learn, and it's great to have opportunities to hear from true experts about the topic. So we are going to do a couple partner updates real quick, and then we'll open it up or excuse me, we're going to do organizational updates real quick, and then we'll open it up to partner updates in about 5 minutes. So the Kansas City Physical Activity Plan, as you know, we always have lots of ongoing sector meetings. We didn't post all of them in this slide. Instead, we put a QR code with a link to where you can find those on our website. So please scan that to find an upcoming meeting that you might be interested in attending. We do have a couple updates, and we'll have Natalie give this first update on the Kansas City Youth Sports Summit.
Yeah. So it's been over a month now. We hosted this event around the World Cup coming to town, specifically around like what type of legacy we could have in youth sports. So it was a very successful event. Standing room only. It was supposed to be 45 people. I think we had closer to 50 some. The director of KC26 came and spoke and about how they were thinking about the legacy. And they thought coach development was something that they could rally around. So we had sessions with some community partners like Johnson County Parks and Rec and Brookside Soccer talk about how they're engaging during the World Cup. Then we had a panel with this is what I wanted to bring my computer. It was I can't remember the name of it, but it's a human rights organization that has youth leadership councils in each of the host cities. So the youth in Kansas City, we have 2 representatives. They spoke about their work and some of the projects they're doing locally. And then the last panel was coaches, and they talked about just the power of coaching and how it has the ability to change youth lives. Based on that event, we've had some follow-up meetings with a group that's interested in engaging with the U.S. Soccer Foundation. They're offering grants, free programming, free training to school districts, after-school programs, other youth sports organizations, not necessarily just soccer. They can do some mentorship programming with coaches. The sports sector is actually meeting tomorrow, and we're going to further discuss that. So if you're an organization that would like to potentially be engaged in some of these free resources, we encourage you to come tomorrow. Noon tomorrow, yes.
I think our next update is our early childhood workshop that happened at the beginning of May. We talked all about early childhood gardening and physical activity related to gardening. There was a brand new training for the first half of the session, all around specifically physical activity and incorporating that in the garden for our little learners. And then the second half was hands-on and learning about how, in what way providers can be engaged in early childhood gardening. And it was a really wonderful workshop and led by all local folks. We had really good feedback, and then we've continued on having a community and practice with those who attended and other providers that want to continue talking about this subject. So.
Hi, I'm happy to announce an upcoming Adaptive Recreation Sports Summit, October 6th. It will bring together professionals from Parks and Recreation, sports, community centers, schools, and adaptive programming. And it was developed in response to some shared priorities that were brought about through recent regional assessments and summit discussions. We're still in the early planning stages, so if you're interested in learning more later down the road, please scan the QR code to include your contact information, and I will reach out to you later.
Great, thanks. So that was Natalie, Kelly, and Katie. For those of you who don't know, all the members of our team, we're really excited about this event coming up on October. This is going to be an opportunity. There's a huge need for adaptive programs in our region, and we're going to identify some ways that we can utilize existing programs and adapt them for our kids that have special needs of a variety of different sorts, whether they may be intellectual or physical. So please, if you're interested, you can scan that QR code, and we'll provide updates as it gets closer to October. Our next quarterly meeting will be in September at some time. We don't have an exact date. So we wanted to put this on your calendar now just because September would probably be too late for many of you to book this. What updates might there be from you all that you would like to share with the group? And you can, people online, feel free to put those in the chat and we can share those as well. So for this meeting, this will be designed for providers. So we will discuss both youth and adult programs, but the target audience will be actually the providers themselves. So if you run a youth baseball league, or if you're running a Parks and Recreation program. Yep. Any other questions or updates? Well, we are happy to share updates through our electronic communication. We send out a monthly newsletter that hopefully you all are recipients of. If you ever have a program or an announcement that you want to share through that method, we can certainly do that. We are happy to elevate all the great work that you're doing. We also have very sector specific newsletters that go out. So if you're working just in ECE settings, we can share it just to our ECE groups. So, okay. With that, thank you for joining us today. We really appreciate everyone coming in. Our next meeting, like I said, will be in September. We do not have a date secured yet. It's hard to believe that September will be here before we know it. Everybody enjoy your summer. It seems like it's going to be a jam-packed, fun summer in Kansas City. So please enjoy it all and be safe. Thanks again. We have the room for about another 30 minutes, so please feel free to stay around and continue networking. Thanks.